All right, today we are diving into the really fascinating intersection of natural substances and supportive cancer care. And we're going to be looking at the science behind a compound from a source you probably wouldn't expect, the humble beehive.
You know, for anyone who has been through cancer treatment or has been there for someone who has, you know that journey can be just incredibly tough. So a huge question in oncology research is always this: can we find better ways to manage the really harsh side effects of treatments like radiotherapy? And that's exactly the question we're digging into today.
So, let's get right into our subject. It's a substance called propolis. But what exactly is it? Think of propolis as, well, basically bee glue. It's this resin-like stuff that honeybees make from tree butts. They use it to seal up their hives, protect them, keep them clean. It's their all-in-one construction and disinfectant material. And it turns out, this stuff is just jam-packed with bioactive compounds, especially antioxidants like cape and chrysin, which scientists think are the key to its effects.
So why is this stuff made by bees getting so much scientific attention? Well, it really comes down to some very compelling research, and one clinical trial in particular that really got people talking.
So here's the setup. Back in 2016, a clinical trial looked at 90 women with breast cancer, and they split them into two groups. Group 1 got the standard radiotherapy treatment. Group 2 got that exact same treatment, but they also took a propolis supplement before, during, and for a bit after their radiation. The goal was super simple. Would the propolis actually make a difference?
And the results? Honestly, they were striking. Let's talk about metastasis. That's the spread of cancer. After 30 months, in the group that only got radiotherapy, almost half, about 48%, saw their cancer spread. But get this, in the group that also took propolis, that number just plummeted to 16%. I mean, that is a massive, massive difference. The rate of cancer spread was cut by nearly 2/3.
But that wasn't all. The researchers also looked at something called disease-free survival, which is basically just the amount of time after treatment that a person lives without any sign of the cancer. And again, the propolis group had an edge. On average, they had an extra 4 months without the disease progressing.
Now, this suggests something really crucial. It seems propolis might not just be affecting the cancer itself, but it could also be protecting healthy cells. The study found that it significantly cut down on the DNA damage caused by radiation in white blood cells. It also helped keep antioxidant levels stable and maintain things like hemoglobin and platelet counts, all of which usually take a real beating during radiation.
So, this all leads to the big question, right? What is actually happening here on a biological level? I mean, how could this bee stuff possibly be doing all of this?
Well, researchers think they have a pretty good idea of the pathway. First, propolis seems to act as an iron chelator. That's a fancy term that just means it binds to iron. This matters because a key enzyme that cancer cells rely on to make new DNA, called RRM2, needs iron to function. So, propolis comes in, grabs the iron, and basically gums up the works for that enzyme. This can slow down the cancer cell's ability to grow and repair themselves. And at the same time, this action also appears to protect the DNA in our healthy cells from radiation damage.
So this proposed mechanism, it points to a really important idea, because even though this study focused on breast cancer, the implications could actually be much broader.
Just think about it for a second. The way it seems to work, protecting healthy cells from radiation damage, that isn't specific to breast cancer. It's related to the treatment itself. So that suggests that these protective effects could, in theory, apply to other types of cancer that are also treated with radiotherapy.
And there's other research that seems to back this up. Take oral mucositis, for example. Those are the painful mouth sores that are a common side effect of chemo. In one study, 0% of patients who used a propolis rinse got severe sores, compared to 16% in the group that didn't. On top of that, other analyses show that propolis can significantly bring down key markers of inflammation in the body.
Okay, so with all of this really promising information, it is absolutely essential that we frame it correctly. This is about understanding the research. It is not a recommendation.
There are several really critical things to keep in mind here. First, propolis isn't a standardized drug. It's a natural substance. Its chemical makeup can be totally different depending on where in the world the bees made it. The right dosage is another huge question mark that needs more research, and maybe most importantly, as promising as that 2016 trial was, it is still just one trial. Science works through replication, and these findings absolutely have to be confirmed in bigger, more diverse studies.
And that leads me to the most important takeaway of all, which I'm going to read directly from our source material, because it's that crucial. It says, note that this information is not medical advice. The goal is to enable active engagement with your oncologist. Look, the whole point of an explainer like this is to give you access to the research so that you can have smarter, more informed conversations with your own medical team.
So as we wrap up, we're left with this really powerful question for the future. As the research continues to evolve, what role will evidence-based, properly studied natural therapies play in helping to support patients through their cancer treatment? It's a field that is just full of potential, and you can be sure we'll be watching it closely. Thanks for joining me today.